Hi, my name is Rebecca. I'm a pelvic floor physical therapist who specializes in the male pelvis. The purpose of this video is to talk about chronic pelvic pain syndrome. This is an increasingly common diagnosis that is common to men. The unfortunate part of the diagnosis is that it is something that most men are unlikely to seek treatment for. Okay, so when we talk about male pelvic pain, we're talking about the muscles that are in contact with the chair. So these are the muscles of your perineum. With this diagnosis of chronic pelvic pain syndrome, these muscles are tight and in spasm. This results in roving pain from the front of the pelvis by the pubic bone and the penis and extending all the way back to the rectum and the coccyx. If you think you're alone in experiencing male pelvic pain and you don't want to talk about it with your friends and you don't want to talk about it at the office, know this: between 2 and 16% of men who seek out treatment have exactly these symptoms. You're not alone. So specifically the symptoms that we are noticing with chronic male pelvic pain syndrome begin with urinary symptoms. That would be difficulty initiating or maintaining a stream of urine. The second may be sexual dysfunction, which would be pain, discomfort with arousal or ejaculation. The third may be bowel, rectal spasms, constipation. And finally, seated pain, which can feel as though you have a urinary tract infection burning along the urethra, but then it can rove around the pelvis through dull, throbbing aches that extend from the front of the pelvis back to the rectum. So if we look at this model, which is a cross-section of the male pelvic floor, what we're noticing are the arrangement of the organs along here. If you were to imagine the muscles of the pelvic floor, they would sit right here, and they would support these organs. So right here is the bladder, okay? Right here is the prostate, and right up along the back is the rectum. So some of the men who come to us, they describe one singular issue. It may be urination, it may be difficulty with sex, it may be constipation. Some men describe 2 or even 3. Okay, so now you can see the relationship and how the muscles here are going to be impacting the position of all of these bodily functions that must take place. So this is a better view of these muscles and their relationship to the organs that I've shown you before. They're very small muscles, and when they get angry and in spasm, as they do in male chronic pelvic pain syndrome, they are unrelenting and won't let go. They won't allow these bodily functions to take place without pain. So what do? Part of our specialty as pelvic floor physical therapists is to identify the cause of this pain, which may be driven by tight muscles. If that's the case, there's plenty of treatment available. Number 1, talking about the issue with someone without stigma, judgment, or embarrassment is a great place to begin, and that's where we would begin with you. Secondly, we would assess these muscles to see how tight they are. If they are in spasm, we would devise a program that would allow these muscles to be stretched, relaxed, and allow the symptoms to dissipate naturally on their own, with the patient's own relaxation techniques taking over. Again, a great place to start. If you're having these symptoms, we understand you're terrified. Go to your doctor, ask for a script for pelvic floor physical therapy, and we can help you. There is a way around this, and it's time to talk about it.